everyone, welcome to DHN's flagship technology podcast. Before we begin, a very happy new year to all our viewers and the DHN community. For more than a year now, we at Digital Health News have been bringing you insights from innovators, healthcare transformers, and industry leaders shaping the future of healthcare. In 2025, we will not only continue the journey, but take it one notch up. To kick things off, we are diving into the remarkable story of world's largest eye care system that has redefined eye care with technology at its core. Since the 1990s, Aravind Eye Care has harnessed IT to revolutionize patient experience. From staggering over 37 million consultations with their advanced EMR system to empowering patients with their flagship app. Joining us today is Mr. Srinivasulu Thayam, the Chief Technology Officer of Aravind Eye Care Systems. Mr. Thayam is a global IT leader with over 27 years of experience. Let's understand from him what goes on behind running world's largest eye care system and how innovation continues to shape the patient experience. Thank you so much for joining, sir. Welcome to the show.
Thank you, Aarti. Thank you, DHN, for giving this opportunity. A very happy new year to all the viewers. And I must say this, that, the DHN is creating the platform, collecting the experience from all the leaders of healthcare community and making it available for viewers. I think it's a great initiative for the community. Really appreciate the efforts what you do, which is what the DNA of Aravind Eye Care system, where we share the best practices of to the entire world actually. So I think we share the common values. Yeah, really appreciate it.
Thank you so much for the kind words, sir. So let's begin this podcast. My first question to you is, Aravind Eye Care System, as I said, I believe is one of the early hospitals in India to realize the potential of information technology. Now, starting in 1990s, your IT department, Auroitech Digital Solutions, has come a long way in transforming eye care. Could you tell us the story behind its journey and how it's making a difference in eye care delivery today?
Yeah, thank you for asking this. Auroitech Digital Solution Foundation is the unit of Aravind Eye Care System, established with the intention of eliminating needless blindness through digital transformation for the healthcare institutions. And most importantly, it aims to provide accessible, innovation, and affordable digital solution designed to enhance the quality, safety, and efficiency of the eye care delivery. And as you mentioned, since 1990, the IT division of Aravind has played a crucial role in supporting the clinical administrative processes of Aravind Eye Hospital. So leveraging the decades of expertise in using the IT services for the clinical work, the division began offering the services to other hospitals worldwide. To address the global need for the digital healthcare solution, data management, and research support and training for the healthcare providers, Auroitech Digital Solution Foundation was officially established as an independent entity in August 2023. Today, the Auroitech has evolved into a very comprehensive provider of end-to-end solution for entire digital transformation of healthcare and hospitals.
So you also have an EMR system called eyeNotes, which has been a game changer for managing patient records, especially with the massive scale that you are handling. What has been the most rewarding part of implementing such a system, and what are the challenges that you have faced along the way?
This is our flagship product, and has been game changer in the eye care industry and healthcare industry, and cumulatively managing patient records over 37 million consultation till date. Okay, so while eyeNotes offers basic essential features such as clinical documentation, compliance, security, interoperability, and the clinical decisions support system, you can customize the clinical workflow through the product. And I mean, the product is customizable for based on your own clinical flow. And most importantly, this is I would say the crux of the eyeNotes. It ensures the patient safety through rule engine and exception handling to validate and reduce the errors. We put all the experience in this product because we see day in day out, like in a day we see 20 to 24,000 patients, and imagine kind of a lessons learned what we learned. So the all the experience has been put in. So that I would call it as a one of the best feature of eyeNotes. And this product has appointment scheduling, traceability of medical record changes, which is very important from the compliance perspective, and telehealth support, which is predominantly top point after COVID. Then integration with the medical imaging packs, then real-time patient insights. That's the because the kind of a data what we capture, and most importantly, electronic prescription where you can reduce the paper. It's like you can make it as a paperless hospital, and evidence-based guidance. That's the another key feature. So then you have an alerts and reminders, and to improve the patient outcome. And beyond this, we have implemented Nomad City, integration recently. And of course, this has got ease of drawing where, drawing images. So out of all these things, my favorite the feature is the iNotes helps to build the data sets. Because of the data sets, it enables us to develop AI models which enhance the diagnostic capabilities, and also offers complete data management with the analytical dashboards and centralized patient information management. We built this iNotes for easy accessibility and availability security perspective in a both on-prem and cloud model. But however, kind of the challenges which we faced by increasing the cost due to the cloud hosting,
Hmm.
particularly from the software licensing and resource consumption. So to address this, what we did, like now, in fact, we are in progress of migrating from our legacy systems to completely microservices based, which is cloud native architecture, and with the open source software. So what happens if you implement the open source software? So this will transition will help to reduce the overall the cost of the product, and of course, because of the cloud native and microservice architecture, it reduces the resource consumption. So that's why our products are kind of our solutions becomes more affordable for the hospitals. So I've been built many products in my entire career, but somehow I felt that this is something where I'm proud of this product, where it addresses the in the key expectation of the healthcare industry. Arti.
Absolutely. Thank you so much for that information. But during my research, one thing that really stood out for me was the integrated hospital management system that has been around for over 2 decades now. I think most of the hospitals in India have started shifting to digital and sort of felt the pressing need to do so only after the COVID pandemic struck. But Arvind Eye Care has been, sort of early mover in that sense, and your integrated hospital management system has been functional for over 2 decades now. How has it shaped the way the eye care hospitals operate, and how has it evolved to meet the new demands over the years?
Some of the hospital, they don't adopt the technologies because of trust in the technology and the cost in the tech due to the technology. That's one type of segment. The second segment is like always like they wanted to wait and see if someone is implementing, okay, then see the experience, then build it. Okay, that's the second type of. Third one is always wanted to be a trailblazer or kind of a front runner to adopt the technology. So that's where I'm fortunate to be part of this, the leadership where Aravind Eye Care system is always has been front runner adopting the new technology and innovative solutions to provide the high quality services at an affordable cost to our patients. That's very underlining concept, like that has been built in our DNA. All patient related data is properly recorded in a user friendly manner, ensuring that the reports from finance, patient statistics can be processed effectively. Implementation of IHM has inspired us to develop iNotes by including EMR, lab information system. So I mean, that's where the eyeNotes has been evolved. So our goal is to expand our offering to build a comprehensive the ARP solution for the eye care hospitals. So,
Mm.
interestingly, if you see, people are talking about the telehealth, the telesupport post COVID, right? We built the hospital management system in the base hospital, and it is connected to the satellite hospitals. We call it as a vision center in the rural place, and so the patients being screened remotely. So this was done almost 20 years ago. Okay, so that is something covering, linking the rural eye centers with the base hospitals. That is the kind of thought process from our leadership, Arti.
So you have developed a mobile app called Drishti, which is mainly for the patients. How do you see tools like this changing the way patients engage with their care, both during the hospital visits and at home?
I mean, we are quite excited to announce this is a first healthcare product from Auroitech to connect directly with the patients. Because if you see, our other products are primarily used by the hospital staff and our clinical
Mhm.
teams. So this app, mobile app, offers typical any mobile app features such as where you will be able to see your treatment plans and your medication prescription, advice on surgeries and procedures, and then information on the follow-up visits, then your family member details, like you can store all your family member details. So in this way
Mm.
the app provides the patients with the convenient, efficient access to their own and their own family member medical records. So I would say, like, the unique feature in our Drishti app is it helps the patient navigate their hospital visits by directly linking to the EMR, and helps with the complaints once they back home, actually. So once they get into the hospital, and they will come to know which unit they need to go, how long it is going to take, and once the initial investigation is done, where they need to approach, that is being guided in the app itself. And it also tell you how much time you need to wait. So during the time, you have a chance to go through some of the health educational resources in the same app. So
Mm.
it would also provide patient condition specific education material for the patient and then their family. So I mean, still is a long way to go for us. Like, in fact, we are trying to build more many more features with the AI and ML. So I mean, I would say, like, this is something with what we have achieved as of now.
You just mentioned about your plans about AI and ML. Looking ahead to 2025, what's on your priority list for Auroitech, and are there any new technologies that you're excited about and exploring further?
Yeah, that's the you know that's the way to go. Okay, so looking ahead to 2025, at the healthcare is set to undergo a significant transformation, shifting from data collection to insights and
Hmm.
data driven decision making. Okay, so now we have so much of data. What to do with the data? So with the
Hmm.
data, you collect, with the entire data sets, you need to explore the insights. Those insights will help you to build data driven decision makers. So I call it as data to decision making. Okay, so
Hmm.
we are excited to focus on developing more clinical decision support models to enhance the accuracy and speed of in clinical diagnosis, investigation, detection of diseases, the conditions, and the prediction of diseases. So to achieve this, okay, you need a data, right? You need to have you need to ensure you have a quality data, and data should be available. Our major focus is we're going to prioritize building the efficient data system, data ecosystem, and digital platforms that integrates technologies such as AML, IoT, then you have a wearables, telehealth, and remote patient
Hmm.
monitoring. So as a part of Auroitech's objectives, we are committed to ensure these solutions are, as I mentioned in the beginning, scalable, accessible, affordable. So therefore, we will place a strong emphasis on researching into the open source technologies. Okay. So I mean, end of the day, whatever you do, models, whatever you build models, that needs to address the community with a, it should be an accessible, it should be an affordable for them actually. So that's where our emphasis more on the open source technology. Additionally, again, we will continue to put our efforts to strengthen the data and IT security by implementing zero trust architecture, digital transformation of hospital. So I'll put it three focus areas, RT. One is building, data decision models, for which we need to build the digital data ecosystem with digital transformation, technologies. Then the third one is more on the open source technologies, okay, where, to make it affordable. Of course, the cybersecurity is a, kind of a underneath layer for all these things.
So as you mentioned, a lot of data is being generated nowadays, now that the hospitals are shifting to digital. And that brings us to the question of data security. Especially in 2024, we have seen there have been a lot of incidences of data breach. It wouldn't be wrong to say that it practically gave sleepless nights to CIOs and CTOs, especially in healthcare. How are you ensuring that sensitive patient data is protected? And what's your cybersecurity playbook at Aravind Eye Care Systems?
Seriously, I think this is a need of the hour. Okay, so in 2024, cybersecurity in healthcare is, indeed critical concern, and protecting the sensitive patient data is more important than ever. So, as you know, the healthcare data is 10 times expensive than any other data. Even
Hmm.
it is expensive than banking data. Okay. So that's where at Auroitech we are fully committed to safeguard the patient information by implementing a multi-layered cybersecurity strategy. Okay, that addresses the evolving the threat landscape. So the Auroitech does thorough security testing, which is essential in identifying the mitigating vulnerabilities, employing techniques such as penetration testing, code scanning, data encryption techniques, and the security audits to uncover address weakness of that software. So what we do, we run vulnerability testing, code scanning, penetration testing for every release. Unless you know the results are satisfied, unless we see the entire score rate is says passed, we will not deploy the code to the production. So we made it as a very kind of, because if you see the Aravind Eye Care system is always provides utmost priority for the patient safety and assurance. So the same with the hospital and in the patient's data. We have hosted all the applications and data in the cloud. We have implemented Cisco SD-WAN almost 4 years back. Okay, so our endpoints are completely encrypted. Our data and rest, data in transit is completely encrypted. So all of this is supplemented by continuous education to the users on their right behavior to the ensure digital security, which is most important. Unless your users are trained, unless you users are having the right awareness, whatever you implement strategies, cybersecurity strategies and tools, which is not going to be helpful. So what we do, we provide continuous education to the entire users. This is the most important thing I would advise for the entire healthcare community.
Absolutely, you are absolutely right, sir. So one thing that I realized while talking to you is technology seems like the DNA of Aravind the Eye Care Systems. In a lot of in other hospitals where CIOs are sort of now trying to move to digital, they're taking their systems digital. One of the hurdles that they face is convincing the top management. But do you think that the top-down approach in your organization sort of helped you develop new products and increase efficiency in your organization?
Yeah, that's where the entire the leadership CXO level is kind of worried about, like because one side you are moving towards the digital transformation, and and the other side opens the doors for the security threat. So fortunately, I mean, it's like a double-edged sword, right? So fortunately, our leadership understands this. We are a non-profit organization, and um, and we need to make every solution as an affordable for the patient. Okay, So where they pay 100 rupees for the consultation, we need to ensure, the patient safety, patient assurance, and the IT security, data security should be managed within that actually. So coming back to your point, fortunately our leadership understands this. They're very supportive, but it is a team responsibility to ensure that whatever the solutions we develop, it should be an accessible, affordable, innovative for the patients.
So, digital healthcare is evolving so fast, and this year particularly was dominated by artificial intelligence. What trends do you think will make the biggest impact in eye care and hospital management in the next few years?
Okay, so let me put it in two ways. One is the initiatives which are in progress, which is going to create an impact in the next few years, and a long-term perspective. So one is immediate, another one is long-term perspective. Okay, so particularly for the immediate, so AI particularly in the field of computer vision, that's the where that's going to be, which is going to revolutionize the eye care. And because the AI algorithms will improve the accuracy, speed of diagnosis conditions such as diabetic retinopathy, glaucoma, and age-related macular degeneration. Okay, these are all going to benefit a lot using AI algorithms, which is basically these algorithms going to help assist the doctors to improve the accuracy, and it's going to expedite the overall the process. So this is one part. Other part, people are talking a lot about the telehealth service. So the expansion of the telehealth services and the remote patient monitoring will be crucial in providing the accessible care, especially for the patients in rural and or undeserved areas. So in the eye care, the telemedicine platform will facilitate remote consultation and screening, while remote monitoring will enable real-time tracking of the patients with the chronic conditions like glaucoma and retinal disease. I think these are all the areas which is going to help from the rural or kind of a needy people. The third part is the AI-powered clinical decision support system. So clinical decision support system will continue to support clinicians in making well informed decisions, and these systems will leverage the large data sets to provide real-time insights and improve the patient outcomes, reduce the errors, and optimize the treatment plans, which is something very important here. So I'll give you a simple example. Let's say this is where we are working on, and we made some good progress. So let's say the patient has visited 50 times, okay, 20 times. Just imagine if you wanted to search 20 visits, it is going to take time. Okay. Whereas I build a summarization using AI. So any doctor can, go to the patient and he'll give you a summarization. Okay. So, and the summarization will help to spend more time with the patient rather going through the records. So these are all is going to help a lot. And another example where we built with the help of the Google, where we built something called we call it as a diabetic retinopathy ADA. Today in India, if you see 1 out of 5 citizens has diabetic. I mean, ideally 20% of populations are the diabetic. To screen 20% of the population, it's going to be impractical, and we don't have so many doctors. So in particularly eye care, so by the time the patient comes to us, they'll lost their vision because the patient doesn't know that they are affected with the diabetic, because the patients in rural villages, they don't know whether they are diabetic affected or not. But unfortunately, eye loss is the first sign for the diabetic, right? If you're diabetic. So we need to have an early screen. Okay, that's where we built diabetic retinopathy with the help of Google. So today, the way we do our non-clinical MLOP, so-called mid-level ophthalmologist, go to a vision center rural, and she does the screening, upload the image to the EMR, and it will give you immediately results whether the person is diabetic or not. Otherwise, earlier a clinical doctor, a ophthalmologist need to, go through the readings, and does the various assessment. It takes 2 to 3 hours. Today, it does our AMR, the application what we have developed does the entire, the assessment and provides the results within a minute. So that we can, do the mass screening, and we don't need to have a, full-fledged doctor to do this actually. So Auroitech has been actively working on these areas, collaborating with our technology partners. So one is rise in remote digital consultation, and empowering patient to be in control their care. So knowing that how their condition is changing, prediction of progress and prognosis. And most importantly, democratize the care using the technology to ensure that all patients get, you know, comparable diagnostic cares and the intervention plan regardless of the provider's capability. Okay, so these are all, I would say, like ongoing activities. But in the future, what we kind of anticipate, there will be a more robotic assisted surgeries, including those for the cataracts and retinal procedures will become more refined and widely adopted. And there will be more AI enabled programs where the patient will be interacting with these programs, and through their mobile apps, where these will be guiding the patients where to go, which physician to visit, and what next steps are. So there will be more patient to AI enabled program interaction will happen. And other thing is AI ability to predict the patient outcomes, readmission risks, disease programs will continue to evolve. And then most importantly, another future what I anticipate is there will be more virtual reality devices. The use of virtual devices, reality devices will increase, will enable clinical staff to receive hands-on, training that accelerates the learning curve. So that is going to be more, dominating in the future.
Sir, my last question to you is, in your illustrious career of over 27 years, you have worked with companies both in India and abroad. How has that global experience influenced Auroitech solutions that can work across maybe different healthcare systems?
Yeah, that's an interesting question. So my view, Arti, every region and every organization has its own unique culture and values, okay, which we must understand, respect, align, align with that, and adapt. So therefore, I had to unlearn all my previous experiences and approach things with an open mind. So this perspective, again, if you see, this perspective has been shaped up my nearly 2 decades of global experience. Okay. So having said this, okay, but my core skills, in the 20 years of global experience, in my core skills, in the product and platform engineering, digital transformation, strategic leadership, which I have developed at previous organizations such as IBM. I was with IBM for almost a decade. Lenovo on the vital communication and DXC technologies, all MNCs in different parts of the world. I mean, are really helping me to build, successful products, to implement innovative services, and high performance organization. You learn from the global experience what needs to be influenced, what should not be influenced. So I was very clear, okay, when I got into this organization, because whatever I worked completely technology based company, this is something completely on the other hand. So that's where I had to unlearn and and learn and adapt and influence whatever my core skills. So now I have an opportunity to very directly influence the delivery of the healthcare with my fellow human beings, a challenge that I am enjoying really. It is, you get the satisfaction because you see the results in the needy people. So what else you need actually? So your technology is creating an impact in a scale. Okay, it's not only in Aravind, outside of Aravind, outside of India. So today our EMR is being used, many non-profit organization hospitals across the world actually. So I mean, what else you need actually? So that's where I enjoy this challenge, Arti.
Wonderful to know that, sir. Thank you so much for being part of this conversation. I personally learned a lot about Aravind Eye Care Systems and how the world's largest eye care hospital runs on technology. Thank you so much for the insights, sir.
Thank you, Arti. Thank you. Thanks for giving this opportunity. Really appreciate. Uh, to share my experience with the healthcare industry.
Thank you so much and have a very happy new year, sir.
Very happy New Year to you and your team for the viewers. Have a great year here.
Thank you.
Yeah.